So today we gave the clinical assessment of articulation and phonology, and what this looks at is her ability to use consonants and words. And the words in this test consisted of those that have anywhere from 1 to 4 syllables and clusters. For example, sk in the word school, so blending two sounds together to make one. So if we look at this chart, the normal range is anywhere from 85 to 115. Your daughter falls below a 55, which does mean she is producing severe speech sound errors, but that leaves room for improvement. And most of her errors right now consist of distortions in the beginning of her words. So a lot of those sounds are distorted right now. And at the end of words, a lot of them she just completely eliminates the sound. So this could be happening for a couple of reasons. One, she could have an articulation disorder where she has trouble making the sounds. She just needs to be aware of where her oral structures are and how to use those to form sounds. Or she has a phonological disorder where she can make those sounds physically, but she doesn't know how to use them in words to change the meaning. So in runs instead of run, and the difference between those, for example. So it could be either one of those, or it could be both, that we need to do further testing before we can determine if it's one or the other, both for sure. So our next step would be to do an oral mechanism exam where we're looking at her oral structure, so her lip movement, her tongue movement, and her jaw movement. That way we know if she's able to make those movements for speech. And then in therapy, we'll start with her speech sound productions, and that way we can start working on improving her intelligibility. And that way those around her can begin to understand her. The good news is her chances of improvement are high because of her ability to improve where she's young. She's still very young, so the earlier you get her into therapy, the better, so you're on the right track. And she also has good behavior, so that also gives us good chances for improvement. But other than that, do you have any questions?
I don't think so. The only thing, when you say her sounds are distorted, what does that mean?
She may be trying to say an but it sounds like an o or something similar. So she's not getting that sound exactly, but she's on her way there.
Okay.
Does that make sense?
Mm-hmm.
Okay. Well, we'll be contacting you to begin therapy, and with that, I'll see you next time.